who have been waiting for this.
Sir, just a moment. Neelam, are you recording this?
Yes, I started recording. It cannot go on Facebook, so I'll put it live later.
No, no, no. Just record the class.
Yes, starting.
Okay, first I will introduce myself.
Yes, sir.
So I'm Dr. Sudhakar, professor of pathology from Gayatri Medical College in Visakhapatnam, which is in Andhra Pradesh. So I did my MBBS from Andhra Medical College, and then I did my PG from Guntur Medical College in pathology. So pathology is a branch which deals with diagnosis. So pathology, they will be we'll be talking about the mechanisms of the how the disease occurs and what are the morphological changes at the gross level, at the microscopic level. So the actual work of the pathologist is to confirm the diagnosis. So a doctor will actually will put one question mark in front of the diagnosis. It may be a carcinoma, it may be a cancer, it may be a tuberculosis, but the pathologist is a person who will confirm and label it, because we'll see the tissue or the disease parts under the microscope, and we will label the disease. So first we will start with inflammation. So the objective of this class, by the end of this class, I want all of you to know about what is inflammation, what are the causes of inflammation, and what are the types of inflammation. Then what are the mechanisms involved in inflammation, and finally, what happens to the inflammatory part? What is the fate of inflammation? This is the objective of this class. So first is definition. Inflammation is a response of the living mammalian tissue to any form of injury. Inflammation is a response of the living mammalian tissue to any form of injury. It is the body's defense mechanism to eliminate and limit the spread of the injurious agent. So what are the causes of inflammation? So inflammation can be caused by the physical agents. Physical agents like heat, cold, the radiation, the mechanical injury. All these are physical agents which can cause inflammation. The chemical agents. The chemical agents are the organic or the inorganic poisons which can cause inflammation. The infectious agents are the microorganisms, the bacteria, virus, fungi, the protozoa, all the parasites. These are all the infectious agents. The immunology. Immunological injury can be because of the cell-mediated injury, or it can be due to the antigen-antibody reactions. The immune complexes, they can cause inflammation. The nutritional causes are hyperglycemia, hypercholesterolemia, hyperuricemia. They can cause inflammation. The tissue necrosis. Necrosis is a form of irreversible cell injury, and it can also cause inflammation. So is infection and inflammation the same, or they are different? So infection is different from inflammation. Infection is invasion of the body by the microorganism, and the resultant ill effects is infection. Whereas inflammation is a protective response of the body to a variety of injurious agents. So in inflammation, there are two processes. One is the early inflammatory response, and it is later followed by the healing. So sometimes, even though this is a protective response, sometimes this can cause a considerable harm to the body. For example, anaphylaxis. So anaphylaxis is a state of rapidly developing immune response to an antigen to which the individual is previously sensitized. So it so happened when I worked in one remote area, one of the doctor was bitten by the honeybees, and he developed anaphylaxis. And there was laryngeal edema. There were a lot of secretions in the lungs, and he was about to die. So it was because of his own inflammatory response, even though it is a protective mechanism, but the rapid development has led to such grave consequence. But immediately the steroids, the corticosteroid was given, and he survived. So inflammation is not always protective. Sometimes it may be harmful. So atherosclerosis is narrowing of the arteries, the coronary artery disease, which can lead to a heart attack, the brain stroke. These are all the consequences of the atherosclerosis. Atherosclerosis is the deposition of the cholesterol inside the vascular lumina, which will occlude the blood vessels completely, and the patient will end up in myocardial infarction, the MI, the heart attack, or the stroke, the paralytic stroke. So the chronic rheumatoid arthritis is also a chronic inflammatory disease. So what are the signs of inflammation? The signs of inflammation are rubor, tumor, calor, dollar, and loss of function. So these are the signs of inflammation. Rubor. So for example, if an ant bites us, or if we had a thorn prick, the first thing that will appear is redness. The redness is rubor. Rubor is redness. Redness is because of vasodilation. The blood vessels are there, they get dilated. So there is redness. There is increased vascular flow, which will lead to redness. So along with the increased blood flow, there is also a local rise of temperature, that is scalar. So the tumor is the swelling. The swelling is because when there is vasodilation, the endothelial cells which are lining the blood vessels, there is a gap between the endothelial cells which allow the fluid to pass through the gaps between the endothelial cells into the interstitium. So there is accumulation of fluid in the interstitial spaces, which is called edema. Edema is responsible for the swelling or tumor. And then the dollar is pain. Pain is because of the compression of the nerves. Because of edema, the nerves are compressed, and also there is a movement of the inflammatory cells into the interstitium, and they release the chemical mediators which will cause irritation to the nerve endings, and it is responsible for the pain. So the last sign is the loss of function. So the redness is due to the increased blood flow, that is due to vasodilation. And calor is due to the increase in the heat. This is due to increased blood flow and increased cellular metabolism. The tumor is due to the increased permeability of the blood vessels, of the increased permeability of the capillaries. So there is accumulation of fluid in the interstitial spaces, which will lead to edema and swelling. The dollar is pain. Pain is due to compression of the nerve endings, and also because the mediators which are released, the chemical mediators which are released from the inflammatory cells, they are responsible for the pain. So the rubor, tumor, calor, dollar, and loss of function, the signs of inflammation. So in inflammation, basically basing on the type of, basing on the duration of inflammation, it may be a very short or it may be a long, basing on the immune status of the individual. It can be acute inflammation or chronic inflammation. Acute inflammation means it is usually less than 2 weeks. When it is of very short duration, less than 2 weeks, it is acute inflammation. If it is going on for months to years, then it is a chronic inflammation. So in acute inflammation, so this is the normal capillary. This is a capillary, the arterial end and the venular end, the normal capillary. So in inflammation, the first thing which has happened is vasodilation. So when there is vasodilation, there is a space between the endothelial cells which has allowed the accumulation of fluid into the out of the capillaries into the interstitial spaces, which is responsible for the swelling. So there is accumulation of fluid in acute inflammation. There is a migration of the neutrophils into the into the spaces out of the tissue. So the main features in acute inflammation are edema. There is a migration of the neutrophils into the extravascular spaces. So the acute inflammation components, there are two components. They occur simultaneously, the vascular events and the cellular events. The vascular events are, initially there is a transient vasoconstriction followed by persistent progressive vasodilation. So the vascular events, in the acute inflammation, there are two events happening simultaneously, the vascular and the cellular. The vascular events are the transient vasoconstriction followed by persistent progressive vasodilation. So following vasodilation, there is an increased vascular permeability. The vascular permeability is increased, so there is accumulation of fluid out of the capillaries into the interstitial spaces. So because of vasodilation and increased permeability, there is a slowing of blood and there is stasis. So when there is slowing of blood, the neutrophils will come to, there is localization of neutrophils at that part. These are the vascular events. So the cellular events are margination, rolling and adhesion, the transmigration, the chemotaxis, and the phagocytosis. We look into each of these. So here we have seen the increased vascular permeability. What is the mechanism of increased vascular permeability? So whatever the maybe the injurious agent, whether it is a mechanical, chemical, or microbial, or whatever the injurious agent, it will act at any of these over the endothelium at any of these things. So the injurious agent can cause the cytoskeletal reorganization of the endothelial cells. So there is contraction and retraction of the endothelial cells. This will lead to gaps between the endothelial cells, and there is accumulation of fluid from the vascular lumina into the exterior. Sometimes the injurious agent can cause the injury to the endothelium directly, so that there is leakage of the fluid from the plasma into the interstitium. Sometimes the injurious agent will cause increased expression of the adhesion molecules. It will cause increased expression of the adhesion molecules on the endothelium, so that the neutrophils will come in contact to the endothelial cells and cause injury to the endothelium. And when there is injury to the endothelium, these vessels are permeable to the fluid. And sometimes the injurious agent can cause formation of new blood vessels. Sometimes there is angiogenesis or neovascularization. The newly formed blood vessels are leaky. So whatever may be the injurious agent, final thing is there is leakage of the fluid from the capillary lumen into the exterior, which is causing swelling. So this is a mild thermal injury following sunburns. So following sunburns, there is a injury to the endothelial cells, which is responsible for the redness of hair. So this next, coming to the cellular events. The cellular events and inflammation are exudation of leukocytes. The WBC will pass through the gaps between the endothelial cells where the injurious agent is there. For example, the microbe is lying just beneath the blood vessel in the interstitium. Then there is the movement of the leukocytes from the vascular lumen into the source of inflammation. The site of infection is exudation. The phagocytosis. Phagocytosis means cell eating. We'll see what is it. So these next, coming to the cellular events in inflammation. So the normal blood flow is axial. Axial blood flow means the cells of the blood, the RBC, the WBC, and the platelets are towards the center. In the periphery of the vessel, there is a cell-free zone. There are no cells towards the periphery. So the normal blood flow is axial or laminar. But when there is a vasodilation, this axial flow becomes slightly disturbed, and the cells appear to move towards the endothelium, and they slowly form very close to the endothelium, and they slowly get attached to the adhesion molecules on the endothelial surface, and they roll over the endothelium, pass between the endothelial gaps, and try to there is emigration of the neutrophils by diapedesis. Diapedesis means passing between the endothelial gaps towards the source of microbial infection. So this will show us the cellular events in inflammation. So we can see the rolling, the adhesion, the diapedesis, the chemotaxis. The chemotaxis is the migration of the macrophages, the neutrophils or the macrophages, towards the injurious agent. And after chemotaxis, there is phagocytosis. Phagocytosis, it will kill the microorganism. The neutrophil will kill the microorganism. So the rolling, adhesion, diapedesis, chemotaxis, and phagocytosis. So the phagocytosis, there are 3 stages in phagocytosis: recognition and attachment, engulfment, killing, and degradation. So this is a microbe. The microbe, on the microbe, there is coating of the antibodies. This is called opsonization. So when there is coating of the microbe by the antibodies, these antibodies have receptors in the vacuole which is formed in the phagocyte. So this is called engulfment. So this engulfment, this will form a phagosome. The vacuole, the vacuole which is containing the microbe is called a phagosome. In the macrophage, there are lysosomes. Lysosomes will contain granules which are the preformed enzymes. They are they will contain elastase, collagenase. So these enzymes, the phagosome will fuse with the lysosome to form the phagolysosome. So the bacteria is then digested by the lysosomes and it is killed. So this is the process of phagocytosis. So the killing of the microbes can occur by two mechanisms. One is oxidative mechanism, another is non-oxidative mechanism. So in the oxidative mechanism, there is formation of free radicals, oxygen-derived free radicals. The superoxide ion, hydrogen peroxide ion, hydroxyl ions, they bring about oxidative damage to the cell membrane of the bacteria. This entire thing is occurring within the phagocyte vacuole, the phagosome. So this will kill the microbial organism. That is one mechanism. The oxygen-derived free radicals, the superoxide ion, the hydrogen peroxide, hydroxyl ions, they cause lipid peroxidation of the bacterial cell membrane and other cell organelles and destroy the bacterial cell wall, which will lead to killing of the bacteria. There are also some preformed granules in the lysosome inside the phagocyte. So these preformed granules will contain the enzymes, the protease, tryptase, phospholipase, and they will induce proteolysis of the microorganism. These are the mechanisms of killing. So how these free radicals will act? The free radicals will bring about lipid peroxidation of the membranes of both the cells as well as the organelles. They will cause cross-linking of the proteins or oxidative damage of the proteins. They will cause damage to the DNA. So in all, this will lead to killing of the microorganisms. So sometimes if these free radicals are liberated into the exterior, they will be counteracted by the antioxidants. So the antioxidants will neutralize the free radicals and prevent the spread of inflammation. So what happens in case of acute inflammation? What is the fate of acute inflammation? So usually in acute inflammation, there is a resolution. It is a very short duration. So there is no tissue loss. Usually inflammation, there is no tissue loss. It can undergo complete resolution by the regeneration of the tissue. If there is a tissue loss, there will be healing by fibrosis. Sometimes the etiologic agent is very robust. It won't, it is not amenable to the, it is not killed easily by the neutrophils. So then more neutrophils will come into play, and that dead neutrophils along with the bacteria will form a pus. So the organized pus, the pus which is formed is called suppuration. So when there are, sometimes when the body immunity is good, there will be healing, but again the infection may occur. So these recurrences, the recurrences of acute inflammation can lead to chronic inflammation. So in the end, the acute inflammation can lead to either there is complete resolution and the original tissue is formed normally, or when the immunity is low, or when the infecting organism is very stubborn, then there is a pus formation. More number of neutrophils will come into play, try to kill the microorganism. That will form the pus. That is the abscess. A circumscribed collection of pus is called an abscess. And later it will heal. It will heal by fibrosis. When there is a loss of tissue, healing will occur by fibrosis. So when there is repeated attacks of acute inflammation, it will finally land up in chronic inflammation. So that is about acute inflammation. So what are the chemical mediators of inflammation? So the chemical mediators of inflammation can be derived from either the cells. These cell-derived mediators of inflammation, the cell-derived mediators of inflammation are derived from the WBC, the neutrophils, the eosinophils, the basophils, the macrophages. These are the cells which give rise to the mediators of inflammation. The plasma-derived mediators of inflammation are derived from the liver. So the sources of mediators are either the WBC or from the liver. The necrosed tissue can also give rise to the. So what are the mediators of inflammation? The mediators are histamine, prostaglandins, leukotrienes, the cytokines. So there is a big list. This is all confusing, but we will remember just a few. So the histamine will cause, it is released from the mast cells and the basophils. It will cause vasodilatation and increased vascular permeability. The prostaglandins are released from the WBC, the leukocytes. The prostaglandins will cause vasodilatation. They will cause pain and fever. So the prostaglandin inhibitors, the paracetamol which we are using, it is a prostaglandin inhibitor. So when there is a pain, when the doctor prescribes paracetamol, on taking paracetamol, the prostaglandin inhibition is there and the fever and the pain will subside. So the leukotrienes are released from the leukocytes. They cause increased vascular permeability. So the cytokines are the chemical messengers of inflammation. The tumor necrosis factor, interleukin-1 and interleukin-6, they cause endothelial activation. So endothelial activation means increased expression of adhesion molecules on the endothelial surface. So next. So whenever there is some form of injury, whatever may be the injurious agent, it will cause the influx of calcium into the cell. So when the calcium is increased into the cell, when the intracellular calcium increases, there is a secretion of phospholipase. The phospholipases will act on the cell membrane of the, whatever the cell may be, whether it's a cell, the phospholipase will act on the phospholipids in the cell and they will give rise to the arachidonic acid metabolites. These are called eicosanoids. So there are two pathways by which these mediators of inflammation are synthesized. One is the cyclooxygenase pathway and the other one is the lipoxygenase pathway. Through the cyclooxygenase pathway, the prostaglandins are synthesized. The prostaglandins cause vasodilatation, increased vascular permeability. So the other branch will cause the synthesis of leukotrienes. So how this inflammation is controlled. So these arachidonic acid metabolites are short-lived. So there is no perpetual inflammation. So these enzymes which are formed, they are they are inactivated by the kinase. Kinase inactivates the bradykinin. The antioxidants, they will scavenge the free oxygen-derived free radicals. They will neutralize. So there is no perpetual inflammation. These are the mechanisms by which there is a break to the inflammatory process. The arachidonic acid metabolites are short-lived. There are the enzymes which are released are inactivated by the bradykinin. The oxidant, the oxygen-derived free radicals, they are scavenged by the antioxidants. The antioxidants, vitamin A, vitamin C, vitamin E, they are the antioxidants which remove the, they scavenge the oxygen-derived free radicals. The superoxide, hydrogen peroxide, hydroxyl ions they are neutralized by the antioxidants. So the major cytokines in acute inflammation are tumor necrosis factor and interleukin-1. And in chronic inflammation, the major mediators are the interferon gamma and the interleukin-12. So we'll see what happens when the tumor necrosis factor and interleukin-1 are released. So the tumor necrosis factor and the interleukin-1, these are the major cytokines released in acute inflammation. This will lead to increased expression of adhesion molecules on the endothelial surface. Then the WBC will come and bind to these endothelial surface and the pass between the endothelial cells and bring about the inflammatory response. And not only that, they will also recruit the tumor necrosis factor and interleukin-1, they will also activate the neutrophils and the macrophages to release the interleukin-1 and interleukin-6 other chemokines. So the protective effects of inflammation. So during inflammation, these tumor necrosis factor and interleukin-1, they are raised. And when this blood reaches the brain, in the brain there is hypothalamus. The hypothalamus is a temperature regulating system. So these tumor necrosis factor and interleukin-1 will act on the hypothalamus. There is a synthesis of prostaglandin in the hypothalamus, and it will set the thermostat at a higher level, more than 1 to 4 degrees centigrade at a higher level. and it will result in fever. So fever is a protective response in which the lymphocytes will act optimally and bring about killing of the infectious agent. The interleukin 1 and interleukin 6 will also act on the liver, and they bring about the secretion of acute phase proteins, the C-reactive protein. So these acute phase proteins, they form a covering over the bacteria. They opsonize the bacteria and help in phagocytosis of the bacteria. So acute phase proteins, the C-reactive protein will happen, increasing the phagocytosis. They also act, the tumor necrosis factor and interleukin 1, they also act on the bone marrow to increase the WBC production. Normally the WBC count is 4,000 to 11,000, but when these tumor necrosis factor and interleukin 1 act on the bone marrow, the WBC count is increased to 15,000 to 20,000. So that when the WBC count is increased, it can easily contain the infection. In case of bacterial infection, there is a neutrophil increase. In case of viral infections, there is increase in the lymphocytes. So these are the protective effects of inflammation: the fever, the increase in the C-reactive protein, and the leukocytosis. These are the systemic effects which will protect against the infectious agent. So there are also some harmful effects. So some harmful effect, when the infection is very severe, the patient will land in septic shock. So in septic shock, there is a hypotension, there is a decreased cardiac output, which will lead to hypotension. There is a disseminated intravascular coagulation. There is a thrombus formation inside the small blood vessels over the entire body. There is formation of clots in the body, in all the blood vessels. So that is disseminated intravascular coagulation. Disseminated intravascular coagulation, hypotension, and alteration in the metabolism. So during the severe sepsis, there is a insulin resistance, which will lead to hyperglycemia. So these three things put together: hypotension, disseminated intravascular coagulation, hyperglycemia due to insulin resistance, will lead to a septic shock when the infection is very severe, in case of severe bacterial infections. So next, coming to the chronic inflammation. So the chronic inflammation means by the time it starts, it's already 2 days. After chronic inflammation means the starting itself, it is delayed. Inflammation, when the first line of defense in the body are the neutrophils. When the neutrophils are unable to fight with the microorganisms, then the chronic inflammatory cells, the lymphocytes, the macrophages, the plasma cells, they come into play, and they will try to fight against the bacteria and kill it. So the chronic inflammatory cells are the lymphocytes, macrophages, and the plasma cells. This chronic inflammation is of longer duration. It will last for years to months. So there are 3 ways by which the chronic inflammation can occur. So the first one is chronic inflammation following acute inflammation. For example, when there is a infection in the bone marrow. So in the bone marrow, there is a chronic osteomyelitis. Even though when we give the drugs, it is very difficult for the drug to reach the bone marrow. So then it will lead to chronic inflammation. Chronic inflammation following acute inflammation. Example is chronic osteomyelitis. The second type is the recurrent attacks of acute inflammation. For example, following repeated urinary tract infections. When there is a repeated urinary tract infections, so you take some antibiotic, it will subside. But again, after a certain period of time, there is a urinary tract. Repeated urinary tract infection can lead to infection of the kidney. That is chronic glomerulonephritis. So recurrent attacks of acute inflammation can lead to chronic glomerulonephritis. Sometimes the starting point itself, chronic inflammation. For example, Mycobacterium tuberculosis. It is not phagocytosed by the neutrophil or the macrophage. Then it will directly start as chronic inflammation. So these are the 3 conditions where chronic inflammation can occur. One is bone marrow chronic osteomyelitis. Another one is repeated attacks of acute inflammation following repeated urinary tract infections leading to chronic glomerulonephritis. The third one is from the starting itself, like tuberculosis. So what happens in chronic inflammation? So there is infiltration, but these cells are the lymphocytes, macrophages, and the plasma cells. this infiltration occurs. In chronic inflammation, there is definitely a tissue loss. There is destruction of the tissue. And this tissue is replaced by the newly formed blood vessels. And this occurs by the newly formed blood vessels. There is proliferation and there is a connective tissue replacement. So this is the microscopy of the chronic inflamed tissue. So here you can see the lymphocytes, the plasma cells, and the macrophages, LMP. Lymphocytes, plasma cells, and the macrophages are the chronic inflammatory cells. So this is the gross appearance of the chronic, naked eye appearance of the chronic inflamed tissue. So this is the red granulation tissue. The red granulation tissue under the naked eye appearance, the skin showing defect, ulcer. So when we see this chronic inflammation under the microscope, we can see the small blood vessels are there. These are the newly formed capillaries, and there are also the blue dots. Each blue dot is a lymphocyte or the plasma cell. So the under the microscope, there is newly formed blood vessels and the chronic inflammatory cells. So there are differences between acute and chronic inflammation. The acute inflammation is of short duration, chronic inflammation, long duration. The main inflammatory cells in acute inflammation are the neutrophils, whereas in chronic inflammation, there are the lymphocytes and the macrophages. So there is no loss of tissue in case of acute inflammation, but the signs of inflammation are very prominent. And in case of chronic inflammation, there is loss of tissue, and this tissue is replaced by the granulation tissue. Granulation tissue is there in case of chronic inflammation. So next, coming to the last part of inflammation. So in inflammation, there are two parts: the early inflammatory response followed by healing. So in healing, there are two processes: regeneration, repair. So regeneration means the tissue is replaced by the parenchymal cells itself, whereas repair means the tissue which is lost, it is replaced by the newly formed blood vessels, and there is fibrosis and scarring. That is repair. So this regeneration will occur in the body. There are three types of cells. The labile cells. The labile cells means they continue to divide throughout the life. The lining of the skin, they will divide throughout the life. The lining of the mucosa, the gastrointestinal tract, the respiratory tract, these are the labile cells which have the capacity to divide throughout the life. There are some stable cells. The stable cells, they will divide only when there is a need. For example, liver. So in case of liver, even though if 90% of the liver is destroyed, it has the capacity to regenerate again and come to its original size. These are the stable cells. So there are some permanent cells. The number of cells which are there at the birth, they will remain till we die. They won't divide. So these are the number of neurons which we got at birth, and the number of myocardial cells which we got at birth. They are fixed. So these are the three types of cells. So regeneration can occur only in the labile cells and the stable cells. In the permanent cells, the regeneration will not occur. So repair. The repair is replacement of the parenchymal tissue by the granulation tissue. The granulation tissue will contain the newly formed blood vessels and the fibroblasts. The fibroblasts will, so whenever there is an injury, that injury is filled with the blood clot. So after the blood clot, from the ends of the viable tissue, there is ingrowth of granulation tissue into the blood clot. There is formation of new capillaries into the blood clot. There is migration of fibroblasts into the blood clot. And these fibroblasts, they will deposit the extracellular matrix, the collagen, and finally they will form the scar tissue. So that is about chronic inflammation. So in chronic inflammation, the final event is healing by fibrosis or scarring. In chronic inflammation, the end result is either there is a chronic granulation tissue formation with scar tissue. So what are the factors which will affect the wound healing? So there are some factors which retard the wound healing. So when we know the factors which are retarding wound healing, we can eliminate, we can try to reduce those factors which retard the wound healing and help in promoting the wound healing. So these factors can be local factors or systemic factors. So what are the local factors? So the presence of infection. Infection will sustain the inflammation and it will retard wound healing. When there is a poor blood supply, for example, in a diabetic patient, there is blood sore. In a diabetic patient, there are bed sores. So in the bed sores, there is a poor blood supply and the venous return is reduced. So there is a very slow wound healing. The presence of foreign bodies in the wound, the dirt will retard the wound healing. And if the wound is completely movement, so if you get damage over the place where there is continuous movement at the joints, it will not favor healing very fast. The ionizing radiation, the ultraviolet light, they will also retard wound healing based on the type of cells. So the permanent cells, they will, fibrosis will occur. And the size of the wound. If the size of the wound is large, it will naturally take a longer time. So the systemic factors are the age. So old age, there is a very slow wound healing. In old age, the healing is delayed. Nutrition. So the nutritional deficiency of proteins, the nutritional deficiency of vitamin C, when there's a deficiency of copper and zinc, there is a very slow wound healing. So when there is a systemic infection, the systemic infection will also retard wound healing. The glucocorticoids, when the glucocorticoids are administered, they will retard the synthesis of collagen, which is supports wound healing. So administration of glucocorticoids will retard the wound healing. Uncontrolled diabetes will retard wound healing. And when there is a reduced blood volume, that also will retard wound healing. So finally, the thing is, if we are taking a refined food, if we are taking very refined food, the junk food will retard will promote inflammation. So these are the list of inflammatory disorders. So in Ahalya stories, we are seeing all these things. We have seen the lung disease recovered, the chronic pyelonephritis recovered, the rheumatoid arthritis. All these things are the even cancer. Cancer, one of the causes of cancer is chronic inflammation. Finally, it is the nature which heals. So we got the capacity to heal. Each of us has got the capacity to heal. The physician will just assist healing. So that's about inflammation for today. That's it, today's class. So thank you.
Thank you so much. Thank you. I am opening the
So-
session for questions.
So I hope I have gone a bit fast, or I I don't know what is your basic knowledge. I have covered as usual for the MBBS students. So if there are any questions, I will try to answer.
Guys, I have unmuted everybody, so you can unmute yourself and ask the question.
Yeah,
Uh,
good
sir-
evening, Neelam. Good evening, sir.
Good evening, ma'am.
Just 1 second, please
So
raise
myself,
your hands
Sandhya.
to ask questions so that it will be easier rather than Sandhya ma'am, go ahead.
Yeah. Good evening, sir. Namaste. So
Namaste.
this is Sandhya here.
Yeah.
Recently, there's a new discovery of inflammatory disease, VEXAS.
SARS.
Yes, sir. So, how is it different from this arthritis disease or the skin inflammatory chronic conditions? Because the same symptoms, the same organ is getting affected. So, on what kind of criteria do they discover the new disease?
I can't answer this question. So
Okay,
I
so
don't know.
another okay. So another question. So you have just mentioned when there is inflammation there, in one of the pathways you have mentioned there is a hypotension.
Hypertension, yes.
Yes. So when patient is, when the client is having a hypotensive condition, so definitely there would be a drop of saturation or electrolyte imbalance.
Okay.
So will it affect the nervous system or will it affect the brain functioning in this condition?
So the hypotension which I mentioned is a severe sepsis.
Yeah, in
So
sepsis,
when
sir.
there is
Yes.
severe sepsis, there will be hypotension and disseminated intravascular coagulation, which will lead to shock. So the hypotension, mild hypotension, it won't affect much.
So does it have any effect on tracheostomy patients? This because most of the tracheostomy patients will have sepsis.
Okay.
So I have seen in my surveys most of them losing their life because of sepsis and this hypotensive condition.
Madam, I don't know actually. I am not a
Okay.
clinician, so I can't answer these things. Basically, I am not towards the patients. So
Okay.
that's
Okay.
it.
So you have mentioned the foods which affect the inflammation part. So can you also quote some anti-inflammatory foods as well?
So the anti-inflammatory things are the vitamin A, vitamin C, and E. These are the vitamins which have an anti-inflammatory. They will neutralize the oxygen-derived free radicals. So the foods which are rich in ACE, they have an anti-inflammatory effect.
So we can we conclude as them alkalizing agents as well?
I don't know, madam.
Okay, sir. Thank you.
Okay,
Thank you,
fine.
Neelam.
Do we have more questions? There was another one who wanted to ask while Sandhya ma'am was talking.
Yeah, Neelam, this is
Hi,
Danya.
Danya. Yes, Sandhya.
Thank you, sir. That was so humbly ended. Nature heals. The physician just as that
Thank
was
you.
so
Thanks.
humble of yours from your side. Thank you so much for this. And sir, I just got a call just few minutes before the session. I'm not clear about the complete history of this patient. So it's the connective tissue disorder, a 17-year-old girl, and it has been classified under Raynaud's syndrome. Which is like the blood flow is yes. So is it somewhere connected to the inflammation? And can you just throw some light over it so that I can have a clear understanding before I talk to the client?
I will refer, madam. I will refer. I will
Definitely,
get you
sir.
on the WhatsApp.
Sure,
Guys,
sir. Sure, sir.
just
So
to-
you
Thank you
want
so
to
much.
confirm,
you want me to tell you regarding about Raynaud's disease? Raynaud's disease is thromboangiitis obliterans. So
Okay.
the thromboangiitis obliterans, the blood vessels get inflamed and they get occluded. So
Okay.
that will lead to necrosis of the tissue. Necrosis is irreversible cell death. The tissue which is lying distal to the blood vessel, it gets necrosed and there is a formation of ulcer. That is Raynaud's disease. So Raynaud's disease actually occurs in case of chronic smokers. So actually, I will get you again. You want me to?
Sure, sir.
So what is the thing you want me to answer? Actually, I didn't get.
No, this is a kind of an inflammation, right? So I just want to have a clear idea how
It is
this
an inflammatory
inflammation
disorder.
occur. Yeah.
It is an inflammatory disorder of the blood vessels. Thromboangiitis obliterans. Thromboangiitis. Itis means inflammation. Angiitis,
Right.
disorder of the inflammation of the blood vessel. Thromboangiitis obliterans is Raynaud's disease. So it is an inflammatory disorder basically.
Right, sir. Yeah. Thank you. Thank you so much, sir.
Thank you.
Any more questions we have? So just a random thought, is blister when we are walking shoe blister would be considered as an inflammation? or would that be considered something else?
Oh, it is inflammation only.
So,
Mechanical
and,
injury. It
right,
is a
mechanic,
mechanical
but
injury.
relapsing,
Real?
is that relapse? It again happens
It
again and
relapse.
again.
It relapse. So actually, they should. Where is that blister?
Sir, mostly on the toes, not on
On the toes. So they
on the
should
toes
change
it
the
relapse.
the footwear.
Sir,
So it
bare
is
feet,
because of mechanical
bare
pressure.
feet relapse.
Bare
So-
feet.
So it happens with the slipper, it happens without the slipper also.
Okay, without the slippers also.
Yes, sir. Yes, sir.
Blister. There is some disorder. There is something related to the skin. So they should consult the dermatologist. That's
Sir, what
I
I
think.
thought was DM2, because you're always mentioning that diabetes can cause it. So I was thinking of that here. I am not pretty sure about that because it's HbA1c is
What is the
7,
age of the age of the patient, ma'am?
32,
32. What is the HbA1c?
7.
7. It is unlikely a diabetic. 7 is okay, madam. 35 years.
Yes, sir. Yes, sir. But like family history of diabetes, so that's why I just had that thought that might be there. That's why I just asked.
I'm not sure, madam.
No worries, sir. I'll share the data with you, and
You
I'll just
please
ask
share
him to
the
consult the
details
skin.
so that I can just refer and can let you back. No.
Absolutely.
So if there are some questions, you can post in that WhatsApp group. I will try to refer and answer all the. If all the rest of the people, if they are having some doubts, I will try to consult my colleagues and I will try to respond.
Guys, just to tell you, Sudhakar sir is pathophysiology. So
Yeah,
that's why there would be things that he might have to get back onto. So still you can go ahead and ask the questions so that we'll get more insights.
Neelam, hi, Revati this side.
Yes.
Good evening, Dr. Sudhakar.
Good evening.
I'm sorry I couldn't join the session on time, but I just have this question. Is there any connection between inflammation and weight loss?
Inflammation and weight loss. No
So
connection.
generally, no
And
connection.
obesity comes. I have to refer.
Okay,
I
sir,
will-
because we all knew that weight gain, yes, inflammation does have a role, but just wanted to understand, is there anything related with weight loss also?
I will refer and I'll let you know.
Yes, sir. Yeah, thank you, sir.
Revati
Yeah.
ma'am, good idea. We can blame not the fat, but the immune
Inflammation.
system of body for weight. Sir, I am not overweight. I have inflammation. Good one, Revati ma'am. That was good one.
And also, Neelam, sir, I want to have an understanding about the autoimmune condition and the inflammation.
Okay, what is the relation between autoimmunity and inflammation you're asking?
Inflammation, because both of them go hand on hand on some cases. But when I see certain reports, the CRF is normal, but the this inflammatory part is always on the higher side.
Okay. I will see, madam. I am not into that applied aspect. So most of the time I will be looking under the
So,
microscope and
Is it
labeling the
that
disease. So
Yeah,
that's
sir.
why
So
I
is
am
it-
not. I will refer
is
it.
it that inflammation causes autoimmunity or the vice versa?
So I don't know. I don't know.
I
I will.
don't know.
I will. I will let you.
Sunday ma'am, I don't know, but sir mentioned somewhere that relapse of urinary tract infection leads to nephritis. So
Chronic
I think they are
nephritis.
related. I think they are related. I'm not sure. Sir would help me out with this.
Oh, chronic lung nephritis is an inflammatory disorder. So
And that is
autoimmunity.
happening because of urinary infection, relapse of urinary infection.
Okay,
So yes,
both
we
are.
can say that.
No, autoimmunity is a different entity. Autoimmunity is a different thing.
Okay. My bad.
Autoimmunity means the antibodies are formed towards the own cells. Our own immune system will attack us. It is like
Yes.
war going. We are kicking ourselves. That is autoimmunity.
సార్ మీరు చెప్పినటువంటి క్లాస్ అంతా కూడా అది మెడికల్ స్టూడెంట్స్ చెప్పినట్టుగా ఉంది.
Sir,
నిజమే.
sir.
నేను డైటిషియన్ కి తగ్గట్టుగా చెప్పలేకపోయాను యాక్చువల్గా. సో ఐఎమ్ సారీ గైస్, ఐ ట్రైడ్.
No problem. Sir, I have
లేదు
Sir, this right very simple.
లేదు
They were
I
very
kept
easy.
you boring all.
no, sir.
సార్
Suresh.
Sir, I had to mute because there were multiple people speaking. So let's hear from one by one.
I have one question, Nilamji.
Yes, Prasanna, go ahead.
Sir, in chronic inflammatory stages, like some of the diseases, they are asymptomatic and their CRP levels are absolutely normal. So what all other inflammatory markers can we looking into, sir?
Okay, CRP is normal. ESR, what happened to the ESR? So one thing is HS-CRP, highly sensitive C-reactive protein. So that is one which is more specific than. So this disorder, what is the patient having? Disorder.
No, sir. Arthritis, some autoimmune
Arthritis.
disorders.
ESR, ESR will help you. What is the ESR?
No, I'm not talking about one patient only, sir. There are multiple patients who don't
Okay.
have any symptom. I mean, they have a symptoms, but all their reports are normal. In that case,
So
what
then
are the parameters?
if all the reports are normal, it is a psychological thing. So I thought that I am having chest pain. So when I did the myocardial markers, it was 0. When I did the troponin I, it was coming nil. So actually it was psychological thing. So
Okay.
then it should be a
Okay, sir.
psychological. If the markers are negative, it should be a psychological pain.
Thank you, sir.
Thank you, ma'am. Thank you, Prasanna, ma'am, for helping me in the diet plan. Thank you, Neelamji, also for helping me, for helping my wife.
Thank you so much, sir. Pleasure.
Thank you.
Pleasure. Sandhya ma'am, you had another question?
Nothing, because I had that same the doubt itself, because CRP is very high, but ESR is normal. How come the infection?
CRP is a more sensitive marker than ESR.
Yes, sir. Yes, and as you said, just you have mentioned the psychological part, because in IBS cases the reports seem to be normal, but the
Inflammatory bowel
symptoms.
disease. IBS means inflammatory bowel
Yes, sir.
syndrome. Ulcerative
Yeah,
colitis or Crohn's disease. Okay.
Yes, sir. Yes. So where the diagnosis part and the reports are very, very normal. All the parameters are just normal, but still you see the patient suffering from the symptoms. So as you mentioned, just mentioned, it's a psychological part. Yes, the gut-brain axis. This has a lot to do with the LGS.
Sorry, madam, what is LGS? I just want to know.
Leaky gut syndrome, sir.
Leaky gut syndrome. Okay.
Okay, guys, we have 4 more minutes before we wind up. If there are any questions, please let us know. Else, we'll just wind up and we can ask questions in the WhatsApp.
So if there are any questions, please WhatsApp in the group. I will try to inquire with my friends and I will let you know.
Sure, absolutely.
So thank you all for your valuable time and giving me a lot of respect.
Sir.
Thank you.
Thank you so much for all this time, because this was a session we were missing. Thank you so much for your time.
Thank you. Thank you, ma'am.
Thank you, guys. Thank you.
Thank you. Bye-bye. Thank
Bye,
you.
sir.
Thank you so much, sir.
Thank you. Thank you all.